So basically, I see some students a little bit confused when they start to program DBS in their clinic. This is why we have to try to keep some order in our mind when you are seeing the patient in the first time after the surgery. So today I'm going to discuss how I do this approach, how I try to systematically do from the beginning in the consultation the approach, the steps. For example, during 1 hour of consultation, what I do with the patient. So basically, imagine that your patient was operated 2 weeks ago. And now you reconstruct the imaging that I think that's, we are talking 2025, it's impossible you program your patients without imaging. So you are in the dark. We need imaging. It's save time, improve your accuracy, and improve the outcomes. So the first thing to do after the surgery is do a good reconstruction. So you get the MRI before the surgery and the post-op CT. Okay. So then a patient comes to your office, and now I'm going to show what you have to do regarding the program. The first thing to do is to set the polarity, and polarity is where you're going to stimulate. I see some students trying to, sometimes I'm going to increase the frequency because the patient is tremor dominant, but no, the first thing to do is to try to figure out which are the best contacts in the left lead and the right lead. And once you know that, you are going to work with parameters. So I'm going to split into 2 videos. This first one, what's polarity and how we are going to find out in our patient the good polarity. And then in another video, I'm going to discuss the parameters, frequency, pulse width, and intensity. So let's go to some slides here that I'd like to show you how I do that in my clinic. So when you are starting program, the first thing to do is to set polarity, as I mentioned, and then you're going to know where we are going to stimulate. For example, imagine here the STN in our patient, and when you do the test, you discover that this is the best contact. So you are doing the monopolar review, you're examining your patient, and you're seeing the imaging. So I put together the clinical examination and the imaging. And then once you know that, you have to start to work with the parameters that I'm going to discuss in the next class. So it's the way you put the current into your spot. Okay, so now we have the opportunity to work with current, pulse width, and frequency. Where I'm going to stimulate, the first thing to do, and how I'm going to stimulate. So basically, when we discuss polarity, there are some concepts here. The first one is how the DBS works. So when you set the cathode here, the negative contact here, and a positive in the box of the patient, or we overall say neurostimulation, or the IPG. The ion, the negative ion, imagine that they are going in this direction. So away from the cathode. So basically the idea here is when this negative ion flows into the brain near the cathode, as you remember, outside the neural membrane, it's positive. So if I'm delivering negative ion over there is a kind of decrease in the voltage between the membrane. And when you decrease the voltage, you are going to elicit the depolarization. So that's the way the DBS works. So imagine that you are doing this 130 times every second. It's really high frequency. And each flow of the ion, we can count in milliseconds. That's the pulse width. So the first thing to do is to test each contact in our patients to see which is the best to elicit the best motor improvement, the rigidity, the tremor, and the bradykinesia. And overall, you start this with the low intensity, and then you increase, and then you set 60 milliseconds and 130 hertz. The other type of polarity is the bipolar, when you put the anode or the positive charge here. So here you are close to the negative. So the ions, they are going to move toward this direction, okay? So when you do that, you shorten your field. So this is a good approach if you are close to the internal capsule or to one desirable zone, close to the STN, GPI, or VIM. Okay, so this is the basic concept: monopolar and bipolar stimulation. So again, when you think about the ion that are going in reverse direction from your cathode, when you put the monopolar stimulation, it's a kind of circular flow of the ion. But when we use bipolar stimulation here in B, you are going to see the ion moving toward the positive charge, okay? So basically, that's the idea. When we discuss polarity, we are going to discuss where to stimulate and where we can set in monopolar or in bipolar configuration. Basically, there are different types of electrodes. You know, the older ones, you have only 4 contacts in each electrode, so you can start and work with the most ventral one, and then the ventral, the dorsal, and the most dorsal. But today there are the directional leads, where you have 8 contacts in each electrode. And again, then you can set bipolar, wide bipolar, short bipolar, or narrow bipolar configuration. Then you can work inside the nucleus. And then you can, for example, put 2 negative contacts that we call double monopolar, okay? And that's how it's look like. So you are inside the STN. I can put monopolar stimulation, or I can set bipolar stimulation. Then you can stimulate these patients. And basically, just to put this in more practical ways, the idea is, once you start to see your patient, the patient is sitting in front of you, and now you are going to stimulate in this monopolar way. This is a monopolar review. So you have to start, for example, in the left lead, and then you're going to examine the wrist of our patient. You're going to see the elbow, you're going to see the bradykinesia, the finger tapping, the tremor. And then you start in the most ventral contact, and then to the ventral, the dorsal. You are increasing the stimulation, you're seeing the efficacy and the side effect, and then you're doing this kind of therapeutic window. And once you decide this is the best spot to stimulate, then you're going to start to work with parameters. I'm going to go through this concept in many other cases here in this channel, and this video is just to put we are in the same line. So the concept of parameters is where you're going to stimulate, okay? And then you're going to figure out this in the first consultation, the left lead and in the right lead if your patient have both electrodes. If you have some question about this topic, please text here. I'll be happy to answer, and then we are going to discuss in another video how we work with parameters. Okay, so have a wonderful day.